This is Fatima, a 35-year-old mom of three. She's tried every diet, every workout plan, and every online hack. But despite her best efforts, the weight refuses to budge. Frustrated and exhausted, she turns to her doctor and hears about something new: injectable medications that are changing the weight loss conversation. These drugs weren't created as diet aids. Semaglutide, branded as Ozempic, was approved in 2017 for type 2 diabetes. Wegovy, same drug, higher dose, was later approved for obesity. Tirzepatide, or Mounjaro, was approved in 2022 for diabetes. Only later did studies show their profound effect on weight loss. What started as diabetes treatment quickly became the weight loss wonder. How do they work? Semaglutide mimics a natural hormone called GLP-1, which helps regulate blood sugar. Tirzepatide targets GLP-1 and another receptor, GIP. By activating these pathways, the drugs slow stomach emptying, improve insulin release, and lower blood sugar. It's chemistry, not magic. But the real breakthrough came with satiety. GLP-1 signals the brain's hypothalamus to reduce appetite. Food cravings shrink, meals feel more filling, and calorie intake drops, often without conscious effort. Fatima found herself eating less without feeling deprived. Dosing starts low to reduce side effects. Semaglutide typically begins at 0.25 milligrams weekly, gradually increasing to 1 or 2.4 milligrams depending on diabetes versus obesity. Tirzepatide follows a similar step-up approach. Patients like Fatima need regular follow-up visits to track weight, blood sugar, and side effects. Like any drug, these injections aren't side effect-free. Nausea, vomiting, constipation, diarrhea, bloating. Most patients feel some stomach issues, especially early on. Fatima found the first weeks rough but manageable. Rare but serious risks exist: pancreatitis, gallstones, kidney problems, and even reports of vision changes or blindness. While uncommon, they must be taken seriously. Fatima's doctor explained the warning signs: severe abdominal pain, jaundice, or sudden vision loss require urgent care. Recently, lawsuits have been filed against Ozempic's manufacturer, alleging patients weren't fully warned of risks like gastroparesis, severe, sometimes permanent stomach paralysis. While the legal battles continue, it highlights an important truth: these are powerful drugs, not casual weight loss hacks. Here's something often overlooked. Along with fat, patients can lose lean muscle. Without enough protein and strength training, this can leave the body weaker even as the scale goes down. To protect muscle, doctors recommend resistance training and a diet with adequate protein. For Fatima, this meant lifting light weights, adding lean meats, beans, and eggs to her meals. One major challenge: stopping these drugs often leads to weight regain. Hunger hormones rebound, appetite surges back, and the weight can climb again quickly. For many, these medications may be long-term or even lifelong. Like blood pressure pills, they work while you take them, but stop and the benefits disappear. Fatima's doctor reminded her, injections are tools, not cures. Success comes from combining medication with lifestyle, balanced meals, regular activity, and stress management. The benefits are clear: 15 to 20% weight loss, improved diabetes control, reduced heart risks, and a better quality of life. But the drawbacks matter: high cost, weekly injections, side effects, and dependency on lifelong therapy. These are not magic shots. With medical guidance and lifestyle changes, Fatima lost weight safely, preserved her strength, and regained her confidence. She now has more energy for her children and more belief in herself. These injections are powerful medical tools, but they're not miracle cures. Their true power lies in partnership with healthy habits and medical supervision. Fatima's journey reflects millions of patients. Medications like Ozempic, Wegovy and Mounjaro are transforming medicine, but they demand respect and awareness. If you found this episode of Medical Minute valuable, give it a like, subscribe, and hit the bell, because sometimes the most powerful prescription is knowledge. And remember, weight loss isn't about perfection. It's about progress with the right support.